Have you ever wondered how plastic surgeons do a deep plane neck lift? The first step in the operation is a 2.5 centimeter incision just in the crease line below the chin. The second incision is an incision in the hairline behind the ear. The next step is to carefully with scissors dissect the skin off the underlying deep structures. Now this type of neck lift is often performed in conjunction with a facelift. However, when we can do it as an isolated neck lift in select patients. In real life, we're just operating through this very small incision, but in order for you to be able to see what I'm doing, I'm actually going to take the skin off the neck to expose the deep structures. So I've removed the skin, and what you can see here is this bulging submental fat. And then this is the platysma muscle, or the deep plane in the neck. So what we'll do here, we need to remove this bulging fat. So I'll use my scissors to gently remove this blob of fat from the patient. And we'll take that out of the neck completely. Next thing to notice is that I'm dissecting under the platysma muscle here, the deep plane of the neck, right out under there. Now this muscle should be joined in the midline. In young people, it is joined in the midline, but in this patient, because she's aged, it is separated and we need to repair that. Once I've elevated the platysma muscle, it gets pulled together in the midline with a series of absorbable stitches just to really tighten up that layer. So just completing the platysma repair, and then we'll move laterally to the side of the head here, coming in through our incision behind the ear. Once again, we'll elevate under the deep plane of the platysma here, and then I'll make a back cut in the platysma so to give me portion of the platysma that I can then pull really tightly up behind the ear, and I'll stitch it behind the ear so we get this tension line just underneath the jawline, which gives that beautiful taut shape. I've placed the skin back on after we've done the neck repair. We just simply close this incision under the chin here, this 2.5 centimeter incision. And then we move to the lateral incision, and laterally here there will be some excess skin that we have to trim because we've tightened up the neck skin as well as the muscle. So it's just simply a matter of cutting out that excess skin, removing it, and then stitching up behind the ear. At the completion of the procedure, there should be a really nice contour over the chin and over the angle of the mandible at the side of the neck. What this procedure won't do is it doesn't eradicate the transverse lines in the neck. It's important to remember that there will be swelling and visible bruising for at least 2 weeks, and you won't see the end result until about 3 or 4 months. At 3 or 4 months, there will be a slight relaxation of the skin, so you have to be realistic. You won't end up with a completely taut skin because we need loose skin on our necks so that we can move our heads around.